I think we're on.
Are we on? Hey, good evening. This is Eric Conti. I'm Superintendent of Schools. I'm here with Patrick Larkin, the Assistant Superintendent. This is our second installment of a BCAT opportunity to share some information about the opening of schools in the fall. I'd like to thank Robert Paris and Jen Dodge at BCAT for accommodating us for another night. Patrick and I were kidding at some point along the week. We were old enough to remember Thursday night TV, and this is certainly not an example of what Thursday night TV used to be. So I know none of the kids who are watching got that joke, but hopefully your parents did. So again, thank you for your patience. We have some slides we're going to go through and then leave some time for questions at the end. Today's talk is going to be about the public health principles for reopening, more about the why behind some of our decisions. We've stated before that Patrick and I are not health experts, we're not epidemiologists. The school districts across the state have been working, school leaders of districts across the state have been working with Ariadne Labs and the Learning Accelerator. Ariadne Labs is a group, it's a group partnership between Brigham and Women's Hospital and the Harvard School of Public Health, and their work has been supported by the 1-8 Foundation, and they're calling this partnership the Parabola Project. So everything needs a name. These two groups are calling their work the Parabola Project, and they are guiding some of the health principles that are shaping our decisions moving forward. So I know PowerPoints aren't wonderful for people to sit through, but I think it's just an effective way to share a lot of information in a short amount of time. So with that, Robert, could we have the next slide, please? Thank you. That's the opening slide, and the next slide. Thank you. Why are we talking about the principles? Is again, I'm not going to read slides for everybody, but there's no single behavior or single decision that we can make that is going to lower the risk. It's really a combination of things and a combination of principles. So just want to admit to everyone from the very beginning, we cannot reduce the risk of COVID transmission to zero. It's not a possibility. But in the state of Massachusetts, it is low. I think it's approaching 1%. And in Burlington itself, I know that the positivity rate is under 1%. And many of the conversations nationally focus on states that have much higher rates of infection. And if the school district existed in one of those states, we would not even be considering opening. But because our rates are low, especially in Burlington itself, we have the opportunity to plan for an in-person instruction. And these are some of the health principles behind some of our decisions. But again, it's not going to be one single thing that we do. It's going to be a combination of things. So in addition to these principles, Robert, could we get to the next slide, please? We also mentioned on our presentation before, we're taking a balanced view of risk. We know that there is some risk to returning. Again, we feel that we can make that risk very low, but there is also a risk to not returning in terms of for students. And again, that risk can include a loss of learning. There can certainly be a social emotional impact on students and children. Many parents I've spoken with, again, are more concerned about their children not being able to socialize with other kids as much as they are about the academic loss. We have some of our students who rely on schools to provide them nutrition, both for breakfast and for lunch, and we have to make sure that we continue to do that. So having schools closed increases the food insecurity for some of our families. Parents are struggling both with trying to work full-time and manage their children's education full-time. That can be a change. And then many of our kids get their essential services, occupational therapy, physical therapy, and other specialized supports obviously are delivered through schools. And there's it's a real challenge to deliver those services remotely. And again, nationally, I'm not speaking about in Burlington in particular, but we've seen a spike in issues related around child abuse, again, when kids aren't in school. So again, there is risk to being open. We acknowledge that. We're trying to mitigate that risk, but there's also risk to remaining closed, to having schools closed. Robert, next slide, please. So the principles behind the principles. And again, not claiming to have any expertise in this area. We're relying on the Ariadne group, and again, that's the group of researchers at the Harvard School of Public Health and Brigham and Women's Hospital. So again, all these slides are going to be available and posted publicly. So again, I don't want to read everyone, but we know that people can carry and spread the virus even if they don't have symptoms. There seems to be evidence that children under 10 have milder cases and spread the virus less. And again, I know people can present research on the other side of all of these items. We're just telling you the group that we're working with and the research that we are learning. Children 10 to 19 seem to look similar to adults, and schools do not appear to be the main epicenters of COVID transmission, and that's looking at other countries that have opened. And again, their main concern is about droplets, and we have to really work hard to make sure that we are minimizing the spread of droplets. Physical distancing, smaller gatherings, and wearing face masks and isolating at home are all components. Again, there's no one single thing. We have to look at this across many aspects of changing our behaviors. And then hand washing, disinfecting surfaces, immunizations are critical to reducing the spread. So we're going to be looking at paying attention to all of those things in terms of lowering the risk at school. Robert? So we're looking in four key areas as part of the guidance from the Parabola Project's stance. Masks. We understand that the Department of Elementary and Secondary Education is mandating masks for grades 2 and up, and they are encouraging younger students, but not requiring it. The guidance that we are receiving is we should have all children wear masks, so that's what we're sticking with. So we should have all students and all staff wearing masks. Anyone who's in the building should be in a mask, and that's the guidance that we're getting. Face shields may be necessary, but what they're saying is face shields need to be worn with a mask. We've had several requests from parents, can my child just wear a face shield? The answer to that is no. There may be instances where, again, a face shield is needed by staff, but those staff will also be wearing a mask to go with that. Distance is something we're going to spend more time on, but this group believes that a minimum of 6 feet should be the goal, and there's a bit of a sliding scale with that, so we need to dissect that factor a little bit more in a future slide, but 6 feet is what we're trying to accomplish. And then cohort size, we believe a maximum of 25 people should be in a cohort, so they don't want us to have large gatherings of people still. One of the reasons that we are not considering a full return at the middle school and high school and preschool, and a full return being all students returning all at once during the school day, is that we believe we cannot maintain a minimum of 6 feet between students, and we can't, and then we would have groups larger than 25. So it would really be those two bottom factors that are influencing that decision. Robert? All right, why masks? And again, I think there's some statistics that you can read, but they really feel masks are a critical barrier to preventing the spread of the virus. And they mentioned one study, and we included it here, that there were 2 hairstylists who were positive for COVID-19 in Missouri, and they saw about 140 clients, and they wore masks, and the clients wore masks, and none of the clients ended up being infected with the virus. So those people clearly weren't 6 feet away, and it just seemed to be wearing a mask properly is going to be something that's going to be critical for us to maintain when schools are open. Practicing having your child wear a mask, I think, is going to be something that's important to do prior to the start of school. We're also going to be working with the local Board of Health, and I think the fire department to make sure that the masks fit properly. That's both for the adults and the kids, and we're going to be working on that, especially with the younger students, in terms of how they can wear masks. We understand there are always exceptions. We'll have some children who have some sensory disabilities who might have some issues with the mask, we will make individual exceptions as needed, and we'll take other precautions with those students. But anyone who can wear a mask, we're going to require to wear a mask if they're going to be back in school in person. Robert, next slide. Again, this is redundant. I just covered this already. Face shields can be an effective barrier, but they're not a replacement for masks. So we want to make sure that people are wearing masks, again, and not just face shields. And the additional support would be wearing masks, but then keeping physical distance. So we're going to be trying, obviously, to have both in place. This group in particular, the Harvard Public Health group, they don't recommend the plexiglass barriers for students. I think there are some schools that are showing pictures, and even some international schools that have the kids all wrapped in plexiglass. What they're saying is that it increases surface area and just adds another surface area to clean, and they haven't seen any evidence that it significantly lowers the spread of the virus. So they're not recommending that we have plexiglass shields in classrooms. There are times when the public or a public area, like at a supermarket where lots of people pass through, some of our desks where the public comes into schools will have plexiglass, and I think that they're encouraging us to sort of use plexiglass in those areas, but not necessarily around student desks. And they're also there may be instances where some of our therapists may need some sort of barrier if they have to be very close to students or be assessing students or evaluating students. So there may be some cases where where we're using that, but we have no intention of having plexiglass barriers in every classroom because of the guidance we're receiving. Robert? This is the more subtle information that goes with the distancing. So again, this group recognizes that 6 feet is our goal. They also recognize that it can't be maintained at all times. So they're saying really between 3 and 6 feet is what we should shoot for. The closer you get to 6 feet, the lower the transmission risk. But also with that factor is the younger the child, they're also saying is the lower the transmission risk. So we are cohorting the kids at middle school and high school primarily to maintain that 6 feet of distance. We believe at the elementary school, with all children back, with splitting up some classrooms, taking advantage of some space, we can probably get fairly close to 4 to 5 feet. And that's going to depend on how many students actually show up in person and how many students remain remote. And so it could be that we could reach 6 feet, but just in taking classroom measurements, we can't return students to every school and every classroom and guarantee a 6 foot. We can certainly, I think, guarantee somewhere between 4 and 5 feet, and then if we divide classrooms, we can, I think, get fairly close to 6. But again, that doesn't mean there's all of a sudden a huge amount of risk. I think we're trying to stay as close to 6 feet as we can, especially with younger students, and then really maintain that 6 feet for middle and high school students. Robert, next slide. They divide up everything that we've been trying to work on and other principles. We are our district working team. We're using these same principles and this same structure. Don't really need to spend a whole lot of time on this slide. We're going to be sending out invitations to Zoom meetings to those groups and where parents and teachers have signed up for individual areas that we're going to have some conversations in. So if you've signed up for those, you should be getting an email from us maybe, I think, tomorrow. And our plan is to have 2 of those meetings next week on Tuesday and Thursday night. And they are just going to be for 1 hour. So again, a limited amount of time. Robert? Again, this goes through the process of what we're going to be going through. So there are questions and details that we've been working through as a district that we'll be seeking some feedback on, or informing each of those principal groups what we've been working on and what we're proposing. And so an example of that would be something we already discussed, where we're going to be encouraging masks, or really requiring masks for all students and all staff which is a slightly higher standard than what the Department of Elementary and Secondary Ed is requiring, but we feel that our guidance is strong, so we'll be explaining why we're doing that. Robert, next slide. And so, again, these are the subcategories under leadership and culture. We need to continue to communicate with family, staff, and the community. We need to develop a plan for surveying families for essential information. Families should be expecting a survey probably sometime next week. We really need to know which students are going to be attending in person and which students are not going to be attending and staying home remotely. Because we're still accountable for your child's education, whether they're at home or they're coming into school in person. We are going to be taking attendance. The remote learning is going to look much different than it did in the spring. It's going to be much more structured, and so we're going to need that information. That information is also going to help us plan and figure out our final social distancing calculations for students in school.
And there's a question on Facebook right now from Mr. Souza about the full remote option and associated resources if parents choose to keep their kids home even if we go back. So the answer to the question is, will there be a full remote option for parents? Yes, that's what we're going to be surveying parents on. And again, we're required to educate our students whether whether you choose for them to stay home or come to school. So we'll talk more details about that in the weeks ahead, but there's definitely a full remote option available for families. And that's, again, to reiterate what Dr. Conti said, something we'll be surveying families on next week.
Patrick, you're also part of the state conversation about a sort of a remote learning platform, a learning management system. So I know the state is exploring partnering with a education provider as a potential resource for students who choose remote learning.
Yeah, I mean, I think one of the big struggles that every district is having, if we have, think of the middle school and high school, the hybrids we looked at last week, an A group and a B group, those are the kids that are coming every few days to school. But we're going to have a third group who doesn't want to come at all to start, and that's fine. So, we may have teacher teams available depending on if staff can't come back. We may be able to align remote teams. That's what we're hoping for. But the state is also looking to provide some resources to kind of help school districts keep kids on track that are choosing remote. So again, we don't know exactly what that looks like. We think we'll get a lot more information on that in the next week or so. So again, we'll update you as soon as we have it.
But whatever happens, the remote learning that's going to take place is going to look different from the spring. I think I've said that 18 times. We'll continue to say that, and I think we're going to need to communicate more details about our remote learning plans coming up, and maybe even dedicate one of these Thursdays just for remote learning.
Yeah, and so again, another good question, and we're going to have a time to answer. I think we'll have close to half an hour to probably answer questions at the end of this. But another good question is, will parents be able to change their mind if they choose remote for children to go back to the classroom? So that's one of the things we're definitely going to articulate clearly. The state is giving us flexibility because, again, we talked about we're setting up our classrooms to try to maintain distance. So if we have, a number of kids that decide, over the course of a couple of days that the families say they want them to come back, we're not going to be able to handle that transition that quickly. So we'll articulate whether it's a 2-week period of time between, if you said our child's been remote, we hear things are going well at school, we want them to come back. We're going to articulate what that time frame will look like. We don't have the answer to that question, but it is a good question. Obviously, it's much easier for you to decide my child's in school and I decide I want to go remote. I mean, that's a little bit easier for us to handle. But to bring kids physically back into the building, there's some logistics we have to deal with. So again, don't have an answer. It's a great question. We will have an answer soon.
But the short answer is yes, you'll be able to choose.
Correct.
We're just not sure on what timeline. So
Correct.
It's not going to be probably a day. It'll probably take us several weeks, as Patrick said, to go from remote to in-person. And obviously in-person to remote is something that can happen much more quickly. But yes, you will be able to change your mind. So those are the surveys that are coming out. We just sent out a survey to staff today, so we're asking that staff also respond to let us know. I think that came from Human Resources, and there are federal opportunities, leaves that employees can take, and so we just need to know who's going to be available and what students are going to be available. And then I can't say enough about the work that Susan Luminello and the Board of Health is doing in Burlington. They have been really helpful to us, and Susan and I talk pretty regularly, and I know that she, as much as we talk, she talks even more frequently with Barbara Conley, who's our nurse leader, and so again, I can't say enough about the support they provided us. And then student and staff training is something we're spending a lot of time with that we're going to provide more details with later on in the presentation. Robert? Again, I'm not going to read through every slide, but these are the principal areas. So we also have a group working on risk stratification and prevention. So we're going to try to provide all families information in their primary languages with some of the risk behaviors and then preventions to the risk behaviors. We have to promote health, disease prevention, and we have to develop a plan to support high-risk staff and students who need to stay at home. And again, that would be the remote learning plan, and we're getting that information now. Robert? Testing and tracing. Again, we don't have access to testing or quick responses as a school district. There are some school districts that are exploring partnering with certain testing centers. I've been in contact with those superintendents. We may be able to do something like that, but we're not going to have the testing ability of, say, a professional sports team or anything like that. But we are going to try to identify a testing path, and again, work with the Board of Health to make that testing as easy as possible. And then we do have protocols that we'll share with all families, and we're going to dedicate another Thursday night. We're going to have Barbara Conley here and almost go through a new parent handbook, or what that would look like, because we're going to need to rely on families to be a partner like we did in the spring with learning. But for students returning in person, we're really going to have to make sure that your children are symptom-free before you send them to school. And so, and if a student does get sick, we have isolation spaces in all of our schools. One fever doesn't shut down a school. I think, again, we have certain protocols, and I think there are other parts of the protocols about how we notify people and what we notify people about while trying to maintain privacy and follow everything else. So that information will be coming out. We have some protocols that we're working on. We're going to share those protocols again with this district working group, and then get it out to everybody and summarize it on a BCAT show probably in the next two weeks or 3 weeks. Robert? Again, screening and triage is sort of linked to that, so we need to have a school plan to what to do when we think we have a suspected case. We have those in place. We just need to get feedback and communicate those out. And then screening symptoms. We're not having schools screen students, so we're not taking temperatures before the kids arrive at school. We want parents to take temperatures before students leave the house.
Yeah, again, just to the isolation space is the plan. Every school, as part of the state guidelines, and again, articulated by the Parabola Project, we're supposed to have a separate isolation space for students that are potential COVID cases. So we have identified those spaces in each school, and we have processes in place to review with teachers. You know, if a student doesn't feel well, what are the symptoms? They would be escorted to the COVID room, so they wouldn't be coming into contact with any students that may be just taking regular medication from the nurse, that type of thing. But again, we'll have Barbara come in and go over those in detail.
And we're very fortunate in Burlington that most of our schools will have 2 nurses on staff every day. Obviously, if nurses get sick, we'll have to cover, but we will have certainly nursing staff in every building. So I think that's important. Robert? Another area that we're going to dedicate an evening to are ventilation and air cleaning and air quality. So we are going to be having all of our HVAC systems analyzed, I'm not sure the right term, by people who do that sort of work. And Bob Cuna, our Director of Operations, is going to be sort of presenting on one of these BCAT nights about the results of those. We've also are going to be arranging to have air quality testing done much more frequently at the start of the school year. I think someone asked last meeting, will those be public? Again, we'll share that information. I'm not exactly sure what that will entail, and I think air quality and air ventilation and HVAC systems are all kind of different. And all of that is really important to note that the machines have to be turned on. So there are times in the school year, the fall being one of them, when the temperatures are actually very moderate, that we may not even have our HVAC systems even on to save energy. So again, we're going to have a whole night dedicated to HVAC. And again, our hope is that the group that is interested in these topics, we will have more detailed conversations next week during those evening meetings. Robert? Cohorting and scheduling. We've done a lot of scheduling work ahead of time, and I've gotten some feedback sort of that looks like you're doing work ahead of the feedback. And to be quite honest with you, scheduling is an art. Our principals are very good at it. They do scheduling most of the time. They know sort of all the details. They understand the teacher's contract, what requirements we have, the instructional assistant's contract. And we wanted the feedback to be on something concrete and something that would actually work. So that's why we spent a lot of time having teachers and principals work on some scheduling options prior to going through some of these principles, because if we just went through the principles and it wouldn't result in a workable schedule, it just wouldn't make sense. So we presented some rough drafts at the preschool, elementary, middle, and high school last meeting. There have been some changes and updates since that, and since we've gotten some feedback on those. And I know that individual building principals, and I know Deb Clark, our director of the preschool, they're going to be sharing information with the families in their schools next week on some of the scheduling decisions that they've made, and sort of so people can respond to very concrete days and sort of what the day looks like. And I think that's going to help with families with some of their planning, and our staff with some of their planning, their own personal planning. And I think it's going to take all of these health principles and I hope demonstrate how we're implementing them in terms of what a student day is going to look like.
Yeah, one of the good questions from I remember the FAQ form we put out, which we'll be posting a lot of those answers very soon. There's over 140 questions right now, so thank you for all the great questions. One is about if students at the middle and high school in the same family are on hybrid schedules, will they be going the same day? And the answer is yes. They'll physically go to school the same day. Mr. Sullivan and Ms. Purchase, our two principals, are going to articulate an alphabetical cutoff. So, you know, Group A will be 8 or whatever, and Group B will be the rest of the alphabet. So that will be articulated soon as well. So if you do have students in the same family physically going to school, that will happen on the same days.
And of course, I know there are families where children may not share the last name. We will make exceptions.
Yep.
We will do what we can to keep families together. So we're certainly aware of that. And again, with all of these rules,
Yep.
with children, there are always exceptions, and we'll do our best to meet all of those exceptions. Extracurricular activities, we're going to talk about in a future slide. We just got that guidance actually after our last presentation at BCAT. So we'll have more information about extracurricular activities. So Robert, could you go to the next slide, please? Masks and PPE. Again, sadly, I think some of the conversations about masks have been a bit politicized. We are just taking a scientific approach. The guidance from, again, the health experts who we're working with are everyone in a mask, both staff and students, and that's what we're going to cling to, and we're going to be making that part of our parent handbook as we establish for the fall. So again, absolutely masks. We have PPE on site, so I think we mentioned in a slide in our last presentation, we'll have enough disposable masks for staff for 2 per day. For the first 12 weeks, we'll have some for students. We also have some of the see-through masks that you see Patrick in. I think we have enough for every staff member if that's what they choose, or for speech language pathologists, or foreign language teachers, or other, some of our professionals where having children look at their mouths articulate is going to be an important part of what they do. We have shields. And then for our staff who need to work directly with children or are toileting children, we have gloves, gowns, and shields. So we should be all set with PPE. And then part of the training staff's going to go through at the start of the year is going to be how to properly use and dispose of that PPE. Robert? Hygiene and personal space. Again, we need to build in time throughout the school day, and hopefully you're going to see that reflected in some of the schedules. It's going to be more concrete at the elementary level. I think Mr. Sullivan at the high school is just increasing some of the passing time between classes. We're trying to have kids mix as little as possible. That's sort of what they're calling cohorting. They want to provide opportunities for kids to wash their hands or to disinfect their hands throughout the day. And we need to make sure that we're cleaning the buildings throughout the day. So we're going to put together plans for both of those situations moving forward. Robert? Density and distance. I learned a new word going through this process. They're de-densifying schools. So I think that what you're going to see when you come into a school area, and maybe we'll do some video tours when the buildings get set up, and they're going to start to get set up next week, is you'll see one-way stickers. You'll see hallways that are one-way instead of two ways. When that's not possible, you may see hallways split in half to make sure students stay on one side or the other. We're fully expecting the first few days of school to be largely logistical. Please be patient. It may take us an hour to get all the kids into the building while maintaining social distancing before they learn the new routines. We have no doubt they will learn the new routines, and once they learn it, we'll be much more efficient with it. But I think we're going to, it's going to take us a few days to figure that out, which is also one of the reasons that we've talked about that where we start may not be where we end up. In fact, it probably won't. And we may be adding features to the school day as we get better at the logistics of the school day and maintaining social distancing and mask wearing and hand washing and all of the other health aspects of that. So again, this is another group that will be sharing some feedback, and we'll be talking about density and distance. This is going to look different in every school. So again, while we'll talk about it globally as a district, the procedures at Pine Glen are going to look different than the procedures at Fox Hill or the middle school or the high school, obviously. Next slide, Robert. All right, so we also source some resources. The Parabola Project, everything is open source. They have all their research available. And so if anyone wants to question the research or wants to present different research, again, we're open to that. At some point, you just need to choose, and we are working with this group and have found their support to be very responsive and their work to be very thorough, and their experiences opening schools in other countries and other states have been really helpful. And so they make all of those resources available to the people that they're working with. So all of those resources are available to us in Burlington, and it's been great. So I'm going to let Patrick talk for a little while when he gets better reviews than I do online. So Patrick, we have some slides that we inserted here.
Sure. Next slide, Robert. So again, these are the groups that kind of make up the principals that we're working with. I'm not going to take the time to read all this to you right now, but we'll be focusing more on particular ones, particular slides or particular principles in upcoming meetings. So Robert, next slide, please. This is something that happened this week, much to our surprise. I think I was sitting actually here at work Monday night around 6, and my son texted me, school's starting later. I'm like, what? So he saw the news before I did, but the Commissioner of Education did agreed to reduce the calendar by 10 years for schools, 10 days for schools, 10 days for school children. And the reason for that is a lot of districts around the state aren't as fortunate as we are in Burlington to have a number of PD days built in. So the Commissioner said everybody needs to spend these 10 days before school starts to go over all the trainings and the safety protocols with staff to make sure that we are all on the same page when kids come in. Because let's face it, it's an anxious situation for all of us. So there's new protocols. We want teachers to be in the buildings, get comfortable with the way things are going to happen, and ask questions, and we'll probably even make some revisions then if teachers notice things that we haven't noticed when they weren't in the building. So those first 10 days will also be dedicated to, again, reinforcing some remote learning strategies, because we will have some remote learning sessions in the afternoon to start at the elementary, and I think there's a couple of remote learning sessions built in as well at the middle and high school. So again, hoping we don't have to go any further with remote learning as the year moves on, but we'll be reinforcing those skills. And also, there will be some students we know that will be doing remote learning from the get-go, so that will help teachers get ready for those students as well. So you see the calendar here says we'll be returning with teachers. We're shooting for a Monday, August 24th return, which will start that 10-day process for us. No? Okay, go ahead, Dr. Conti. I messed it up already.
No, you're doing great. I'm going to say draft 100 times.
Yeah.
This is a draft. We need it to change. We asked the commissioner if we had to use all 10 days. The answer was yes. We asked the commissioner if they had to be at the beginning part of the year. Could we spread them out? The answer was no. There are pretty strict rules about the 10 days, and they have to be at the start of the year, and we have to use all 10. Burlington teachers, as Patrick mentioned, they have a 187-day contract, so that might be a little bit of a different arrangement than most people are familiar with. There's 180 days for students. There are 5 professional development days built in. There's a day that's dedicated for classroom setup at the start of the year, and there's a day for parent conferences. So those are the 187 days. We had built in 8 days in the prior calendar that we discussed, and I guess if imitation is the finest form of flattery, the state is maybe imitating us, but it really threw us for a loop. So what we'd like to do is the first day was Tuesday, August 25th for teachers. What we're maybe thinking about, and we need to obviously talk to the union and to have there be agreement, but we want to make sure the teachers have that setup day where they can come in, make sure their classrooms, their desks are spread out. We're taking some furniture out of classrooms, but they may need some time to find some resources because their classrooms aren't going to look like they normally look. And many teachers collect stuff over years, and their classrooms are very personal spaces. And I know many are going to feel like this is an intrusion into their personal space, but we have to make sure that there's social distancing and the desks are set up in certain ways. So I think having that setup day available for teachers is going to be important. Then the clock starts on the 10 days on Tuesday, August 25th. And then we are allowed to take students in during those 10 days. So again, it's also something that we need to negotiate or bargain with the teachers and some of our other units, but we'd love to bring some students in early to make sure that they have time to adjust to the new schedule. But primarily this would be a time for teacher training, learning protocols, learning safety, learning routines, learning remote teaching skills. So we're going to have 10 days to prepare for the start of the school year. The 10th day actually ends up being Thursday, September 10th. So we were slated to start Tuesday, September 8th. And when talking to some of the principals, and again, we have yet to discuss this with the teachers, is they thought sort of a soft opening might be something that would be really important to do on Thursday the 10th and Friday the 11th. So what they are talking about potentially doing is having grades 1 through 5 start on Thursday. Kindergarten students usually start a week after normally, so they would start on Monday the 14th, but just have a few days for grades 1 through 5 in. The middle school, because they're talking about doing an AABB with half the kids, starting on a Thursday would be somewhat difficult. So they thought of maybe doing grade 6 as a transition for that Thursday and Friday, and Mr. Sullivan talked about having grade 9 students in for that Thursday and Friday. They typically, for those grades, do a lot of class meetings and orientation on those first days anyway. So we would really spend most of the day orienting, most of those 2 days orienting grade 6 and grade 9 at the middle school and high school. And then Monday, September 14th would be sort of the full start date for the early childhood, for kindergarten, again 1 through 5, and then for all the other grades. So that was a proposal that we had to adjust to because of a change just a couple days ago. I think the intent of the change is positive. The impact on the rest of the calendar, because we still have 5 professional development days and a parent-teacher conference day, so we would still have 6 days that we need to schedule, and we need to work with the school committee to fit those days in for the rest of the year and come up with a working calendar. But the calendar's been a real frustrating thing for us to work with because the rules keep changing on us, and then again, this was just one proposal. I don't like just presenting changes. I like sort of making them as concrete as possible, and that sometimes gets me in trouble because people think, oh, the decision's already been made. This decision has not been made. I just wanted to take the new regulations that we have and apply it and say what the impact would be on the calendar. So we're going to start roughly around the same time, but it looks like a delayed start for students. Most students until September 10th, and then all students on September 14th.
And no school in the state can start after what date, the commission?
What's that, Wednesday?
So it'd be the 16th.
Yeah, I think the 16th.
So every school has to start by September 16th?
Yes, every school will start by September 16th.
For students, yeah.
For students. So those are the rules, and we asked again if we could bend the rules, and we're told no.
Next slide, Robert. So these came out at the end of last week, on Friday actually, the Allied Arts and Specialist classes. So again, our specialist teachers are still looking at these with us, and we're making sense of how we can best manage under these guidelines. But again, the band and the chorus indoors is not going to happen as it has typically, again, due to the fact that there's more droplet transmission with those activities, with the woodwinds and the brass and the singing, obviously. So some of those may be possible outdoors, but again, we're looking at some logistics. And the same thing with physical education activities. There's some parameters. I think there's no physical contact allowed, and no sports like that in regards to PE classes. So again, we'll have more in-depth guidelines on what that might look like for students as we move forward. Next slide, Robert. So the remote learning guidance, again, is based a lot on parent feedback from across the state, and a lot of what we saw in Burlington as well. So highlighting again that there'd be structured synchronous and asynchronous learning. I think the biggest complaint we heard in Burlington was there was too much asynchronous learning. So we'll have more concrete schedules of when students would be learning remotely moving forward. And then the attendance tracking, the state is telling us, again, for students, whether they're in school or they're at home learning, we need to track their attendance, and we need to note that in our student information system. So if your student is home, they would get a check mark and they're doing remote learning. If they're in school, we would be checking that they're physically in school. In both cases, they get credit for learning that day. There's no difference, but the state wants us to clearly delineate who's in school learning, who's out of school learning, and just that's really for us to also track student well-being to make sure students are staying engaged with school. Again, the Massachusetts learning standards apply. There will be grading, and you can see the other one, unified learning platforms, is something that we heard a lot about. So we're really going to have a non-negotiable for teachers to use certain tools. And we'll again be providing training for that during this opening 10 days. We'll actually be starting that earlier in August. We talked about that last week.
And Patrick, just to reiterate, remote learning isn't only about technology. We did purchase extra consumable materials, so students will be able to have consumable materials at home. And so we also got that feedback. It's not just about sitting and being online all day, and we understand that. And we'll have other materials that are available. And the state, again, is looking to contract with other education providers that will help supplement the remote learning guidance, both at the elementary, middle, and high school level.
Yeah, and just to reiterate another thing we said last week, we actually for our younger elementary students bought extra workbooks so they could have workbooks at home and at school. They won't have to worry about them going back and forth, and also more writer's notebooks. So again, we want to really make sure we balance that not everything's on a screen if we do have to do significant remote learning again. Next slide, Robert. You want to cover this one?
Sure. Again, we have just continue with our remote learning planning. Remote learning has to be a part of all of our planning because we are being told we have to prepare for the school buildings being shut down just in case the virus, again, if the virus erupts again. So we're trying to match our hybrid schedules. We're trying to match the in-person schedules with the remote learning schedules, so the transition for students would be smooth. We are sending all iPads home with all students back and forth. So students, even young students, will be needing to take their iPad back and forth to school, and there are some risks associated with that, but we feel like we have to be prepared to shut down and make sure everyone has the tools they need at home. We are talking about making sure that the programs that we're using and limiting those programs will certainly help us do a better job of maintaining the privacy of student data, and that's going to be a priority for us. We may need a remote teaching team depending on how many students are choosing remote, and as we said, a remote teaching team may mean that your child may be taught by a teacher from a different school. We're trying to make sure that we have a balance of teacher licenses and teacher expertise in different areas. Obviously, it takes a certain talent and expertise to teach students how to read, different than a high school physics class. So we have to make sure that we're matching teachers in the area that they're in. The teacher idea that we mentioned last time was even if schools are closed, if the buildings are closed, we've had several teachers ask if they could deliver their remote instruction from their classroom because the Wi-Fi is strong and all their supplies and materials are there. So it could be that the buildings stay open even if the students are not allowed to be there. And again, as we've been mentioning a lot, the state's working on a remote learning platform that would be available to all students. Again, it's not free, that would be at a cost to the district, but they would endorse the content of the courses being taught. And again, I think would provide more structure and more content for students who are learning outside of school. Robert? Parent and staff surveys, again, the staff survey went out tonight. Parent surveys are going to be probably going out Monday or Tuesday. We're going to have a limited time for people to respond, but it's almost going to be like filling out registration materials for the school anyway. Our Aspen, our student information system, is rolling over tonight, so all the new parent information should be uploaded even with our new incoming kindergarten families. So we should get that to everyone who needs that. And again, we just need to know who's going to be in school and who's going to not attend school, and that's going to help with our planning. For staff, if any staff who are watching, if you have issues, again, in the staff survey, that information will be obviously confidential. It'll be handled on a case-by-case basis through human resources.
All right, I think that's it.
Robert,
And,
I think we're done. There we go.
Questions
All right.
coming through online. There was a question about can students wear whatever masks they bring in from school and staff, and I think there may be some rough parameters around masks, like I don't know if they need to be I don't even think they need to be a cloth mask because I know we bought a lot of disposable masks, so I'm pretty sure there will be that flexibility I just don't want to be too open about it. I think they have to, as long as they fit correctly, and we're going to be talking more about how to put masks on and that type of question would be one for Barbara Conley, our nurse leader. But yes, I think we'll have that flexibility for people to bring their own masks, obviously, but we also do have enough masks to cover our students and our staff for at least the first few months of school if people need those. And
I think that'll be one area that the district working group is going to get more detailed on.
Yeah. And a great point by a mom here, I believe. She said it's hard to answer a survey when we don't know the plan yet. And so that's 100% true. The final plan won't be submitted till the week of August 10th, which is a couple weeks down the road. We do know there are families that are pretty confident right now they do not want to start in-person schooling. So that's who we want to, if people are solid with that right now and they know we're going to have full remote learning available for their children, we want to know from those families if they definitely will not be starting school. And again, we'll give a timeline. If the first day of school is September 14th is when we start with everyone. September 10th, I know we have some groups coming in. We'll probably give a time frame. You know, if you let us know 2 weeks in, we can have you, like what that's going to look like. We don't have that articulated yet, but that's a good point. And we agree. It's hard to say if you're comfortable sending your child to school if you don't know exactly what it's going to look like. So we understand that.
We are asking principals to start to communicate with families in terms of what the draft schedules are, and we have to call them draft, and we will continue to call them draft, just to try to get you some idea as to what the day and week is going to look like for your child, to help inform those surveys. And again, all of that has to be bargained across all of our unions, and because time is of the essence, we're concurrently planning and bargaining at the same time. It's just the only way for us to get through that.
Yep. This parent right here was asking about providing parent tech days as well on tools like Seesaw. And we do have, and we'll be sharing that information probably when we send the email tomorrow morning on some upcoming sessions that you can look forward to for parent technology as well. So that's something we've committed to. I think we said it last week. We overestimated that, no offense, because I'm still figuring some of this stuff out myself. I have a high school student in another district. But we overestimated parents' comfort level with the technology. So we're going to provide a lot more support with that. Another question was about allowing student Gmails to be opened up so parents can, I think, communicate with their students through Gmail. I think there's something that might benefit parents that way. I'm not sure, but we'll talk about that more. I know our big reason for not opening up the emails to people outside the domain is because we don't want to have communication to email of our especially our younger students, without knowing who's communicating with them outside the domain. But I'll check. We can talk about with the technology department. I'm not sure if there's a way to whitelist certain email addresses if we know it's from a family member. So we'll talk about those logistics as well. Let me go to the other question. If they use Seesaw, they need to stop posting PDFs. Okay. We did hear some of that feedback as well. I think, again, we learned a lot in the spring about what's working and what's not, and we will have more engaging resources posted than PDFs. We agree. PDF is where ideas go to die, typically.
No, and I think it was also about privacy, not sharing, not having everyone else see other student work too. So,
yes,
so
that came up last
I think we were going to do some training to make sure that the student work can't be viewed by everybody.
For elementary students who choose to go remote, would they be primarily taught by teachers from other schools, or does that only apply to higher grades? Again, I think that applies to elementary schools in particular. If we have a large group of students at home, you may have a first grade teacher from another school teaching your first grader if they're part of the remote team. Again, a lot of this is going to depend on how many students are starting at home with full remote, and how many staff members potentially can't start in person because of family situations or health issues. So that's something that we're gonna have more details on moving forward, but we will have licensed teachers teaching students wherever they are. That's 100%.
Or we'll try.
When is the hard cut off on plans, and when will we know who teachers are? I mean, I think from the school district standpoint, our cutoff on our plan is when we submit it to the Department of Ed the week of August 10th, which we're looking at August 14th, which is that Friday, I believe. Again, we've said this before, the virus is going to decide some of this for us. If things are spiking in the weeks that we're doing our 10 days with teachers, you know, the governor may decide something's going to stop, you know, something's going to change. But our plan for starting in September will be finalized that second week in August, as much as anything can be finalized right about now.
Yeah, because then we're going to have to, very soon after that, teachers are going to be returning, and then class lists are going to get put together. And so it'll be really once we decide the modality of instruction in the fall. So, and even if we the school committee decides to go fully remote, we're still going to have to place students in classes. So I think that work's then going to take place between August 14th and probably the early September.
Yeah, another great ask here is something we've talked about. I don't know if we've said it publicly, but asking about a dedicated tech support place for families. And that's something we've committed to. And we just want to make sure that we can get your issues resolved as quickly as possible. So I had a call with our instructional technology people from the buildings and one of our IT staff members today. And we're going to be talking about that. That we know we're going to need people to solve problems quickly so kids aren't hung up and families aren't hung up. So we're going to make every effort to do that. So hopefully you'll see some clear details on whether that's a phone you call or a open hangout where you can pop in and ask somebody a question. We'll figure out what that's going to look like. When a child stays home sick, or say they were quarantined because a family member was exposed and they have to be quarantined with that family member, can they jump onto remote learning at that point to stay involved? I think the answer is going to be yes. I don't know if it would be immediate that day. I can't see why not. But again, because we don't know what numbers we're dealing with yet, we have to hold off on responding to that. So they will be able to.
No, it's an idea that makes sense.
Yeah.
So again, we wouldn't restrict the numbers. I just think we need to figure out how to do that. And again, our responsibility is to take attendance. So we would just need to know that's not, your child's not out sick that day, but your child is home learning that day or something.
Yeah, and I mean, I'm going to talk openly here. So if we were going to have the teacher in the front of the classroom with their laptop on, everybody could watch the teacher teach, but that's not the type of teaching we want to do in classrooms. We want it to be more engaging than the teacher standing in front of a classroom all day. So that's why, somebody may be thinking, why can't you just turn the camera on? That's not the kind of classrooms we encourage, especially if you've been in one of our elementary classrooms. The teachers are moving, kids are moving around center to center. I know that's not going to happen now. So it's tough to give you a concrete answer, but those are some of the things we're working out in the next couple weeks, so you'll know more what it looks like.
Yeah, I just think the remote learning is going to be much more flexible, or adjusting to remote learning is going to be much more flexible than having us adjust to new students coming in person.
What are the nitty-gritty details about how mask wearing will be enforced, even among cool teenage people that well, I won't keep going, but we will have strict mask guidelines, obviously. That's what keeps people healthy and safe in this environment right now, especially if they can't maintain physical distancing. So again, staff and students, it's going to be a requirement. As we said, we're hoping to enforce it K-12, pre-K to 12. If there's individual student needs or issues that somebody can't wear one, we will make an accommodation, obviously, but we also, with that accommodation, have to make sure everybody else in the classroom is safe.
If there's a student who refuses to wear a mask, then
they're going to have to be a remote student.
Yeah, they're going to have to be
ultimately.
a remote student. So
Yeah.
that's just where we're at.
Let's see. When do parents need to get back on their plan sending? I mean, I think we talked about that. We're going to get it out this week. We'll probably give a hard date of like the end of the following week, and we'll continue to share more details. I'll encourage families to call directly or email if they're struggling with the decision and there's a question that we can try to answer that would be the deal breaker, whether they're coming in or not. But again, we'll have a lot of conversations and opportunities. Our emails are easy to find, and don't hesitate to reach out. And we're in the office Monday through Friday.
And speaking with Bob Cuna, I think the buildings are going to start to get set up for sort of COVID learning beginning next week.
Yeah.
So what we might do is, as classrooms get set up, we might take some pictures of those classrooms or do a video tour. I think a parent mentioned that would be helpful to them. So that's a possibility that we can do that. I know we're coming to the end of the hour, Patrick. We'll continue to look at your questions, so thank you so much. I know it must be frustrating that we don't have every answer. We are learning as we go, and then some of our plans that we already felt were done are being changed because the rules change on us afterwards. So we're trying to communicate those changes. Next Thursday, our plan is to have Bob Cuna join us, and he's going to be talking about HVAC, air quality, and some of the physical plant questions that people have seem to be coming up, and just to try to get some concrete answers there. We're not going to be able to change the HVAC systems that we have, even in the older buildings, in the 4 weeks that we have before school starts, and we don't have the resources to do that either. But I think we're just going to give a report on the status of the equipment that we have and what some of our plans are regarding, I guess, the physical plants of buildings. So if you want to prepare questions, next Thursday is going to be about a lot of physical plant questions. And then the following Thursday, nurse leader Barbara Conley is going to join us, and she's going to talk a lot about the health protocols and maybe go through some of what we're expecting families to do before their children leave the house. So those are the upcoming 2 next Thursdays for can't miss Thursday night.
That's right.
TV.
Must-see viewing.
Must-see TV.
So yeah, thanks for all the great questions. Sorry we didn't get to answer them all. There is a FAQ document with over 100 questions that we're working on publishing. Also, we'll have the slides put up on the website this evening, and I know some of the questions that people asked that might have come on late, you would just click through the slides and you'll see the answer. But thanks for the engagement, and we'll be back next week with another exciting program.
That's right. Good night. Thank you.